Matters to all of us. I'm Trisha. I'm excited to be your host for this live show. We've got a great show lined up. We'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry, how to keep your teeth clean and healthy, and also ways to get dental care that doesn't cost too much. Whether you know a lot about teeth or just want to learn how to make your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in dental technology. We've already got some questions for you, our viewers, and we'll answer for them. Plus, you can ask questions during the show. Before we start, let me tell you more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in Dallas-Fort Worth area in Texas, and guess what? He's even writing a book that's coming out next year. If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of our teeth. Let's begin our dental live show. Welcome everyone, and let's welcome Dr. V to start our show.
Hello, hello, hello. Welcome to another episode of our Dental Dilemmas. Like Tricia said, thank you very much. I'm a periodontist, which is a fancy word for gum specialist. I founded ToothHQ Dental Specialist, and we got 4 locations in the Dallas-Fort Worth Metroplex. We've been here for almost over 13 years now. So thank you for being loyal viewers, and anytime you have questions, and make sure you're going to put them live or at least put them in for our next show. We'll be happy to answer them for you anytime. And make sure that you're going to subscribe to our channel so we can keep you updated of what is going on in the dental world. And without any further delay, we can get started.
All right. Okay, so I have a couple questions that I'll be asking Dr. V, and he'll be giving his answer to them. So let's get started. So our first question says, "Hello, doctor. When does one require gum surgery?"
So the question is, when does one require gum surgery? So whenever you're having any type of periodontal disease, whenever somebody has periodontal disease or gum disease, there are different grades to the level or the extensity of the gum disease somebody might have. So for example, in the layman term, we say gingivitis, or early stages of periodontal disease or gum disease, or mild to moderate periodontal disease, or advanced gum disease or advanced periodontal disease. Let's say somebody has mild to moderate or gingivitis, they may just require as simple as a regular cleaning, or what we call it as a deep cleaning or a deep gum therapy. Or when you have advanced gum disease, or sometimes the moderate can turn into advanced, that's when you are going to need gum surgery. So anytime you have advanced gum disease, we can say that you are going to need gum surgery. And as you know, in our office, what do we do for advanced gum surgery? We do what?
Laser.
There we
Laser
go.
surgery.
Right, laser gum surgery. So we do in our office, and we don't make the traditional gum flaps and opening up the gum tissue. We want to make it as conservative as possible, as non-invasive as possible. So we do the laser non-invasive, minimally invasive laser gum surgery.
Okay. All right. So the next question says, "I received dental crowns, and while 2 of my teeth have undergone root canal treatment, 2 have not. Now I'm experiencing redness and swelling in my gums."
So what the caller is asking is, I received dental crowns, and those 2 have undergone root canal treatment, and the 2 have not. But overall, she is experiencing a redness around the gum tissue. We talk about gum disease in the show many more times than anything else, because we are, as you guys know, we are a gum specialist. So one of the most common reasons why people have redness and swelling around the gum line is because of the periodontal disease or gum disease. More than likely, from what I'm hearing from you, you already got two crowns and then you had the root canal done, um, at the time you had to go through the treatment, more than likely the dentist might have given the crowns to you to get you out of pain or to save the tooth. It is very possible that you may have some active gum disease, which is what is causing the redness or the swelling around the gum line. So my recommendation is you go back to the dentist and get your gums checked out to make sure that you do not have periodontal disease or gum disease, and just to make sure that your investment is going to be worth and your investment is going to stay with you. Because if you let it go, you have already spent money on getting the crowns and root canal treatment. Now if you're going to let it go, then the gum disease is going to get advanced and you're going to possibly end up losing your teeth. So don't let it go see the dentist.
Go see Dr. V.
Thank you. Exactly, yeah.
All right. I have three front teeth that are loose. Doctor, what is your advice on this matter and how should I move forward?
So, what this viewer is asking, she got three front teeth that are loose, and of course, I wish I could come into your mouth and see what is going on. I can't really tell you without looking into the mouth or without looking at the extensity of the looseness that you are experiencing. It could be if the looseness that you're experiencing is very mild, it could be as simple as possibly getting some kind of a deep gum therapy or a deep cleaning or a laser gum therapy that is going to help tighten the gum tissue around the tooth, which is going to help fix the problem. Sometimes what we also see that is the gum disease or the looseness can happen because of what we call it as a severe bite issue. So for example, this is your top tooth and you keep constantly hitting on the top tooth with the bottom tooth, then we recommend what we call it as a bite adjustment. As you know,
Mm-hmm.
we do filing, right, of
Yes.
the opposing teeth or the top teeth. So that could possibly take care of the problem. Or sometime if the gum disease is so severe to the degree we call it as a class 3 mobility, there is nothing can be done to fix either uh, through gum treatment or via bite adjustment treatment. You may have to end up losing your teeth. So from what it sounds like, it may not be that severe. So before it gets severe, go see the dentist or go see a periodontist and they can help you take care of the problem
Before it's too late.
before it is too late. Exactly, right.
All right. Okay, so what are the treatment options for bone replacement in the upper teeth, including the cost involved, and does ToothHQ offer these treatments?
So what this viewer is asking, what are the treatment options for bone replacement for the upper teeth, whether we do that at ToothHQ and what is the cost for that, right? So uh, again, I wish I could go into your mouth to look at exactly what problems you are experiencing, and I'm not really exactly sure what you're talking about when you're experiencing bone loss. If it is as simple as like a mild to moderate bone loss, then or even sometime advanced bone loss, as you guys know, we are in the business of saving teeth as gum specialists and periodontists, and we die hard every day to save teeth for people. So when you have mild to moderate or even sometime advanced bone loss, we are able to do some kind of a gum surgery, including the non-invasive or the minimally invasive laser gum treatment, to be able to help save the teeth and fix the bone loss. If the bone loss is too severe to the degree that you are not a good candidate for either receiving the non-invasive gum treatment or some form of bone grafting procedures to fix the gum disease or the bone loss, you may have to end up having to lose the teeth. Even then, we still offer the bone grafting procedures to create the bone or reconstruct the bone. You can still end up can be a good candidate to replace those teeth using dental implants. So the bottom line is, no matter how severe the bone loss is, and it could be mild or to advanced, we can still treat you to with some type of bone grafting procedures.
Right. Okay. Hello, Dr. V. Can a tooth that's been split in half be successfully restored?
So the question is, when the tooth is split, can it be restored, right? It depends on how bad the split is. So if it is a small split, say for example, a part of the tooth just split, and you can get a crown. If the tooth is completely split, what we call it as a through and through split, it went all the way from the top of the tooth to the end of the root to the bottom of the tooth, then you really can't fix that. Then you need to have the tooth removed and have the tooth replaced with a dental implant or any other form of tooth replacement, for example, a dental bridge or a partial denture. And of course, in our office, then we always recommend you go with the dental implant option, because that is exactly what the patient described as a dental implants. They look, feel, and function like a natural tooth. So whatever your age may be, you want to have something that's going to closely mimic to the natural tooth, which is going to look, feel, and function like a natural tooth. And we recommend you get dental implants.
Okay. I've lost my 3 front teeth. What are my options for fixing them?
So what this viewer is asking is, I've lost 3 front teeth. What are my options to fix them? So anytime you have a missing tooth, your options are, of course, the best option, which is going to be the closest one to replace the natural teeth, which is going to look, feel, and function like a natural teeth. Our recommendation will be to have the dental implants. Can you do a bridge? Of course, losing 3 teeth, and if you have a long span bridge, we call it, and you're going to put so many teeth in jeopardy by doing a long span bridge, we do not recommend. And can you do a partial denture? Of course, you can do a partial denture. On the front teeth, particularly, it is not going to be the best option because you're going to show through like some of the plastic, or when you smile, some of the plastic is going to show through. Unless you don't have a high smile line, you may be okay. Again, what are your options? You can either get the dental implant, which is the best option, or you can consider a bridge, which is not my recommendation. Can you get by with a partial denture? Possibly you can temporarily, but the long term, I would recommend you get a dental implant because you don't want any further bone loss to be jeopardizing your lip positioning or like the way that you are going to be able to speak or talk, which is not going to be a good thing long term.
Okay. Our next question says, I've lost my incisor tooth. Doctor, can you tell me more about affordable treatment options, including other costs? Including their costs, and guide me on the next steps to take.
So what this viewer is asking, I have lost my incisor tooth. Incisor tooth means the one that you have in the front, the 4 front teeth. Either we call them the one on the side, we call them as a lateral incisor, or the one in the front, we call them a central incisor, as you can see here in this picture right there. This is a lateral incisor and this is a central incisor. You have one on each side. So those 4 front teeth, these are called the incisor. So depending on whichever tooth that you lost, you can definitely get a the treatment option, or as I said earlier, either you can get a dental implant or you can get a bridge or you can get a partial denture. Of course, our recommendation, which is the long term and the best and option, would be the dental implant to replace the tooth, and you can go with the bridge, which is going to be slightly less expensive. For example, an implant could be approximately like about $3,000 to $5,000. A bridge could be anywhere between $2,500 to $3,000, or maybe a little bit even more than that. A partial denture could be as low as like possibly like about maybe 300 upwards to about $750 to up to $1,200. Long term, if you think about it, although the implant could be a relatively more expensive option, which is about $3,000 to $4,000, long term you're going to save a lot of money, because with the partial denture you have to replace it after 3 to 5 years. Or, the most common complaint we hear, my dog ate it, right? So you don't have to worry about your dog eating it, or you don't have to worry about losing it, because I even have patients, they put it on a piece of paper and then
Throw in the
somebody throw it
trash.
away in trash, right? So you don't have to worry about those. So the long-term option, the best option would be to have a dental implant, but talk to your dentist about whether you can have a bridge or a the posture denture.
Okay. Um, Next question that I have is I'm concerned. I'm sorry. Hi, doc. I've noticed that some of my teeth are longer than others. Is it possible to adjust their length?
So, what this viewer is asking, she is concerned about some of her teeth being long and whether any treatment can be done. Well, we need to first find out what caused the long teeth, right? And one of the most common things that we hear in our office for the long teeth, for two reasons. One, if it is a mild bone loss or a gum loss, which is caused by what we call it as a gum receding, then the most easiest and the best option would be to do what we call it as a gum grafting procedure. So we can literally pull the gum tissue down. If you have lost a lot of gum tissue, then we can pull the gum tissue down and then put it back, and that is the most easiest option. Sometime these long teeth can happen because of extensive periodontal disease or a gum disease. Then you have lost all the bones surrounding the whole tooth, and that is now causing the long tooth to happen. Again, to fix the problem, in our office we do a multitude of procedures. For example, the laser gum surgery or the non-invasive the gum surgery. We do that to fix the long tooth. Again, is that going to 100% fix the long tooth? Possibly not. And the best option will be to prevent this by any further long tooth to happen by fixing by doing the laser gum treatment. In some occasional cases, if the long tooth cannot be fixed with either the gum grafting that I said earlier or the laser gum surgery, you may need to have the tooth replaced with the dental implants. And of course, the best answer I can give you would be to go see the dentist or go see a periodontist, and they should be able to recommend the best treatment option for you.
Yeah, I agree. Okay. Um, I'm concerned about cleaning my teeth because they seem unstable and I'm worried they might fall out. Can I get some assistance with this?
So what this viewer is asking is, and I'm concerned about even getting a cleaning done because their teeth are feeling loose, the teeth are feeling so loose that she's concerned about like them losing them even during the process of cleaning. So sounds like you probably have left your tooth for too long, and that's the reason why they're so loose now. And sounds like you probably have extensive periodontal disease or extensive gum disease. So if you're concerned about losing them even with the just regular cleaning, again, without seeing your mouth, I can't really comment on that. Talk to your dentist and what are your best treatment options. So if they are not to the degree that you don't have to lose them, uh, then the dentist can or the periodontist can recommend doing some type of a laser procedure or some kind of a gum procedures, gum surgical procedures or bite adjustment procedures to help you save the teeth. Or if they've gone beyond the point that they cannot be saved, then again the dentist or the periodontist you're going to see can recommend the best treatment option for you to replace those teeth. And here's what we can't normally see. You are thinking that you are going to end up losing the teeth that by getting the cleaning done. It is one of the most common myths that we hear. So don't worry about them that you are going to end up losing them just by getting a cleaning done. Go see the dentist, and before it is too late, like Tricia said earlier, before it is too late, go see the dentist and they may be able to save the teeth for you.
Yep. Okay, so we have a live question coming in from our audience. It says, I am a 53-year-old man dealing with severe gum disease and I'm covered by Cigna Dental Insurance Plan. Am I eligible for laser gum treatment under this insurance?
So the question is, I'm a 53-year-old man and I have Cigna dental insurance and I have gum disease and I need laser gum treatment, and is my insurance going to pay for it? Am I going to be eligible to get the treatment done under the insurance plan? The answer is absolutely yes. If you are a candidate and if you have gum disease, irrespective of your age, and we did this laser treatment on a I think she's 87 or a 93-year-old lady just last week. So you are definitely going to be eligible to get the treatment done, laser treatment done. If we find out that you are a candidate for laser gum treatment, and is that going to be covered by your insurance? And anytime you have any type of uh, treatment that you need for gum disease treatment, most of the insurance plans are going to help you pay for that. So the answer is, if you happen to be in the Dallas Fort Worth area, come see us at ToothHQ. We can definitely help you. As you guys know that we do offer free consults for all our patients. So come see us at ToothHQ. We can definitely help you. Or if you happen to be in another part of the country, no matter where you are, go see the dentist, and the dentist should be able to evaluate what type of gum disease you have, whether you are a candidate for any type of laser gum treatment, and whether they can help you under your PPO plan. Or even when you have a PPO plan, sometimes you may still end up having to pay something out of pocket. So in our office, we do have extensive affordable payment option that we offer. Or as a matter of fact, any part of the country you are in, whichever dentist you are going to, they should be able to help you with the payment options they have, in addition to your insurance going to pay for a portion of the procedure.
All right. Thank you for that live question. Okay, so the next question I have says, Doctor, I have a broken molar. Could you advise on the possible treatments and the next steps I should take?
So the question is, doctor, I have a broken molar. What they mean by broken molar is the molar teeth or the back teeth. So these are the back teeth here. It could be the top like this. You have the back teeth, or it could be the bottom. They go like this, and then you have the molars. So when you have a broken molar, what are your treatment options? Of course, when you have a broken molar, the minimal that you need to have done is you need to have the tooth removed. If you do not, then you are going to get infection. When you have infection, the infection is just not going to stay in one part of your body. It is going to get into your carotid, and it is going to go into your heart. From there, it is going to go into the different parts of your body, your lungs and kidneys and pancreas, and all the way to the brain. So don't let the infection go. So have that tooth removed. And many a times, and if it is a broken molar, we always recommend you get a bone grafting or you get a tooth replacement at the time you're going to have the tooth removed. So at the minimal, have the tooth removed. At the minimal, at least have the tooth removed and the bone grafted. Or the best option will be to remove the tooth and do the bone grafting and do the tooth replacement all at the same time. That is what we do, don't we?
That's what
Trisha?
we do. That's what we do every day.
There we go. Yeah.
Okay. As a senior, I'm in need of dental implants and I'm looking for grants or special offers to assist with this cost. How can Tooth HQ help me with this?
So this viewer is a senior. He needs a dental implants, and he is looking for some kind of a grants. And how can Tooth HQ help them, right? So we do see a variety of patients, and we have patients that come into our office and they write a check for several thousands of dollars, and then they get the treatment done. And again, they get a free consult, and then they write us a check, and there we go. And we do have patients, and we do have like a patients with some socioeconomic condition. They are not able to afford for any type of treatment, and they still come in, and we offer them for free consult. Guess what? Like sometimes they think that they cannot afford, but after they come in for a fact, we are able to still give them an affordable treatment option, and they didn't know. And then, oh, I didn't know that, doc, and they are still able to to offer, we are still able to offer the treatment payment options, and then they still move forward with the treatment. Of course, sometimes we have patients, they cannot even, they are on social security and they cannot afford any type of out-of-pocket payment options at all. So then we do find some options for them. For example, we work with some nonprofit clinics. We can send them to the nonprofit clinics, and then sometime we have connections with Parkland dental clinics. We have connections with the dental school clinics, and we do have several nonprofit clinics we work with. So either through these nonprofit clinics, or we do have some options that we know of. Some of the clinics, they work with the grant they get from the Texas, the state of Texas, so we can send them to those places. So the best option would be that if you happen to be in the Dallas-Fort Worth area, come see us. We'll be happy to help you, or whichever dentist that you're going to, ask them about these nonprofit clinics, or find the nearest dental school, or just Google search what are the Texas grants available, or Parkland, or the dental schools near you, so they should be able to help you.
Mhm. Are there any alternative treatments to dental implants for missing teeth?
So the question is, are there any alternative treatment options to dental implants for missing teeth? There are multiple options and to dental implant. So the options are either you can do nothing. We always say in medicine, you don't have to do anything. Just because, we talked about, just earlier, somebody missing a molar tooth in the back. So do you have to really replace it? You don't have to. Always no treatment is an option. And if you don't want to leave it, which I do recommend you don't leave it without having any type of treatment, you can have, if it is a one tooth in the middle missing, you can grind the two teeth on either side, and you can have a dental bridge. Again, which is not the best option, because I do not recommend, because you are going to end up grinding two virgin teeth, one on each side. You can have a tooth replacement using a partial denture. Partial denture is what we call it as a flipper, which is again not the best option. A flipper is going to be something like this. It is going to be a piece of plastic. Or if you have multiple teeth missing, you can have multiple teeth put in on the flipper, like missing this here, but you can have a multiple teeth, or if you have missing all teeth, you can have a denture like that. So sounds like you may have concerns about being able to afford for the dental implant. Again, we have been able to help many patients who had that myth in their mind of not being able to afford for dental treatment. We have been able to help. So come see us if you happen to be in the Dallas-Fort Worth area, or talk to your dentist wherever you are, and they should be able to give you some type of treatment options that you can even possibly can afford as well.
Okay. All right. So our next question is, what are the signs that I might need a wisdom teeth removed?
So the question is, what are the signs that I should be watching for that I need to have my wisdom teeth removed? It could be as simple as you have some pain, you have some pain, or you have a severe pain. One of the most common reasons why we remove in our office all four wisdom teeth. Most of the time, that's what happens. Patients are being put to sleep, get wisdom teeth removed, all four wisdom teeth. I think we did like maybe three sets of wisdom teeth today. So the pain, uh, the swelling around the gum tissue, you're not able to open your mouth wide, and you have some jaw pain. Whenever you sleep on one side, you have some severe pain. You have bad breath. You're not able to bite your teeth together. You're having difficulty in chewing your food. And so these are multiple signs that you need to have the wisdom teeth removed. Again, I can't tell you without looking into your mouth. The best option is when you go to the dentist. The dentist is going to do what we call it as a panoramic radiograph or panoramic x-ray, or they are going to do a CT scan. and they should be able to give you the recommendation of whether you need to have your wisdom teeth removed or why you need to have your wisdom teeth removed.
I agree. All right. Okay. We have the new session that we're going to start doing on our live. It's called the rapid fire questions. At this time, I will ask Dr. V a couple of questions, and basically, he has to answer them as fast as he can. You ready?
So you're putting me on a
I'm
challenge
putting you
now,
up to the
right?
test.
Yeah. So I can't be a talker anymore,
No.
right? Okay.
All right. You ready?
I'll try.
Okay.
All right.
All right.
All right. Let's do that.
Let's do it.
All right. Cool, man.
All right, first question says, "Hello, doctor. I learned that ToothHQ is providing complimentary screenings for oral cancer. Can you describe what this process involves?"
So, what the caller is asking is about the complimentary oral screening. So, anytime you go to a dentist, and we are all supposed to be doing an oral cancer screening. So, what that means is we are going to screen your mouth quickly, either inside the mouth or outside the mouth, whether you have any type of oral cancer. So, it is complimentary when you come to Tooth HQ because we do free consultation anyway. And anytime you go to a dentist, and it is part and parcel of the exam, so they are going to do a complimentary oral screening, and it is needs to be done every 6 months.
Okay, that was fast. Good job.
Thank you.
All right, the next one says, "I aim to instill excellent dental habits in my 5-year-old child right from the beginning. Can you recommend how to choose the right toothbrush, toothpaste, and mouthwash for her?"
So the best, the toothpaste, toothbrush, and toothpaste, toothbrush, and the mouthwash. Toothbrush, I recommend, like if it is a 5-year-old, buy a soft toothbrush, and then some of you guys heard this in the past. Like you go to Amazon, these are like 99 cents timers you can buy. So make sure that you're going to buy those timers, and your child is going to brush their teeth for at least 2 minutes. And you can buy some toothbrushes with timers on them. They have 2-minute timer. They keep lighting for 2 minutes, so buy them. And mouthwashes, you have to buy something that has some fluoride in it. And then also the toothpaste, you have to buy something that has some fluoride in it. So these are all some of the recommendations I have that you can instill on your child.
Sure. How does fasting influence or benefit my oral health?
So, how does fasting? That's a great question. So, fasting, when you do fasting, that is going to reduce the inflammation in your body. I do a lot of intermittent fasting to reduce the inflammation. I teach courses. Inflammation is connected to 52 oral diseases. Just do a Google search. How is the inflammation connected to all diseases in your body? So, that is exactly what's going to lead into the periodontal disease as an inflammatory disease. So anytime you do fast, that is going to reduce the inflammation, and that is going to help reduce your gum disease, and that is how it is going to improve your oral health. And also it is going to reduce cavities, because cavities is going to be an inflammatory disease also.
I didn't know that.
There we go. See, you
Yeah,
learned
I
something.
didn't know
Yeah.
that. Are dental x-rays safe, and how often should they be done?
So are dental x-rays safe? Absolutely they are. We say, hey man, we are in Texas, right? So you go stay in the hot Texas sun for about an hour. That is equal to having a big complete set of x-rays done, right? So dental x-rays are absolutely safe. Some of you guys may have read this in the news, and American Dental Association, just like a few months ago, they even took the requirement of having to place a lead apron on you, and even including pregnant women. So we still place them just to kind of make the patients feel comfortable, but you don't need to have a lead apron anymore to have the dental x-rays done. So that means how safe they are. How often you need to have done? You need to have them done as often you need to have done. If you're talking about a complete set of x-rays, we call them bite wings. We do them once a year or once every couple of years. But if you needed to have them done sooner than that, absolutely go for it, because they are completely safe.
Okay. All right. Okay, the last question of our rapid fire is, are over-the-counter teeth whitening products safe to use, and are they effective?
Absolutely. So, are there over-the-counter products? Absolutely, there are. Are they safe? Absolutely, they are. That is the reason why they are being left over the counter. So you can buy as simple as you can buy some toothpaste, or you can buy some strips that you can apply, or you can buy some whitening gel. There are some trays that you can make if you are able to buy those trays, and you can make them custom fit, and then you apply some gel and then you wear them. So there are multiple options available, and of course they are being left over the counter because they are still safe. But don't do it DIY if you have signs of gum disease, which are bleeding, bad breath, and swelling and looseness and all of that. When you have those, do not do them. So if you feel like you have healthy gums, go for it. They're absolutely safe.
Are they effective?
They are absolutely effective as well. Yeah, so sorry, I did not answer that part of the question. So they are absolutely effective. And I have patient, a matter of fact, we had a patient today. She asked me what is the best whitening, and she had some decent teeth. So I told her, hey, try the whitening toothpaste, and absolutely they are effective. And you can try different things, and you can go in gradient, try the toothpaste and then the strip and then the gel, so you can grow in gradient depending on how effective they are for you.
Yeah. Yeah, actually was like a personal question. I was wondering that too. So, hey.
Oh, I thought you had white teeth.
It can always be whiter.
Always. Always there is room for improvement, right?
Yes.
There we go.
All right, so that was the end of our rapid fire. I think you did a great job, Dr. V, answering those.
Thank you for putting me on my toes.
I got
Yeah.
to. Okay, so back to our regular questions. Hi, Dr. V. I'm uneasy about the use of anesthesia. I'm considering exploring laser treatment for my gum disease. Is anesthesia necessary for these procedures?
So what this person is asking is, sounds like this person has gum disease, and she has been told she needs laser gum treatment and she needs some type of anesthesia. So she's asking whether it is really required. So I want to make sure that you guys understand that. So when you have very minimal or very minimally invasive, sometime when you have a regular cleaning done, we can do some laser treatment with absolutely no need for any type of anesthesia. That means even local anesthesia, which means numbing your mouth. You can do that. We can just sometime do that just with a little bit of a topical, like a or gel type of anesthesia. But when you have moderate to advanced gum disease, when you are going to need some type of laser treatment, you are definitely going to need some type of local anesthesia. So you can't get away with that. Otherwise, there is no way we can do the laser treatment effectively for you. But if your question is related to whether you need to be put to sleep to get the laser gum treatment, the answer is no. We do this all the time, as you know, Trisha,
Mm-hmm.
right? Do we do IV sedation for all the laser treatment?
No, not for
Not
all of them.
necessarily, right? So when you have some just a laser treatment done, so you don't need to be put to sleep. And we do have, this is what happens in our office. And sometimes when we have patients and they don't have a ride, they can take them home. They don't live with anybody else, and they don't have anybody to watch them on the night of the procedure. So we don't want to say no to those people, and we still want to help them. So we definitely do the laser treatment absolutely every day with no IV sedation or any type of sedation whatsoever, just with the local anesthesia. So if you happen to be in the Dallas Fort Worth area, if somebody has told you you need IV sedation or some type of sedation, come see us and we can help you here.
Definitely. Okay. It looks like we have another live question coming in. This one says, I have a persistent sore on the roof of my mouth. Could this be a sign of oral cancer?
So I have a persistent sore in the roof of my mouth, and could that be a sign of oral cancer? Absolutely. The answer is yes. The number one reason, if you go talk to anybody any dentists are there. We are going to say that when you have, we call it as a non-healing ulcer. So when you have a non-healing ulcer, that is one of the most common reasons to why you need to have that checked out, and that could be a reason you may have oral cancer or signs of oral cancer. Do you know what we do in our office?
We do biopsies.
There we go. Can you explain to them what a biopsy means?
So when we do a biopsy, we basically cut a piece of the gum, or is it the
Your lesion, yeah.
lesion, and we send it off to a lab. They'll fax us back in the results, and we'll have you come back in, and the doctor will read the results out to you. Basically, then you know if it is surgical or not surgical, cancerous or not.
Non-cancerous, right? So imagine, right? Imagine, like, let me give you an analogy. Like, let's say if you are a woman, for example, you had a lump in your breast or like a small lump that you found, and your doctor is going to recommend, hey, I don't like the way that you have a lump and I don't feel comfortable leaving it. So I recommend we take a small sample of it, send it to the lab, they have them look under the microscope, and then let's see whether it is cancerous or non-cancerous. Exactly the same thing in the mouth. If we have a really, really tiny ulcer, we completely excise it and we completely remove it and send it to the lab. Or if we have a bigger ulcer, and we want to find out before we completely remove it, it is non-cancerous, so we take a small sample of it, we send it to the lab, have the lab tell us whether it is cancerous or non-cancerous. Depending on that, we take the next course of action.
Yes.
Did I answer that?
You did. So
Thank you.
So coming in the office can save your life.
Absolutely. Yeah. There we go.
Okay.
Well, let me ask you, do you feel comfortable when you have a lump on your breast to leave it alone?
No.
Absolutely, right? Yeah, that's the
Don't
reason
ignore
why.
it.
Don't ignore it. Exactly. Particularly with a non-healing ulcer when it could be cancer.
Yeah.
Absolutely.
And it could be too late.
It could be too late. Yeah.
That's my catchphrase for this show. It could be too late.
I'm going to write it down. I'm going to write it down. Yeah. Don't wait until too late.
Okay. Our next question is, hi, Dr. V. My 11-year-old son lost a permanent tooth during a sports activity. Are dental implants an option for him, or are there any age limitations?
So the question is, my 11-year-old lost a permanent tooth during a sports activity. Is dental implant an option, and are there any age limitation? What this person is asking is, they probably heard from somebody that, hey, am I too young to be receiving dental implant? That is such a common concern that we have. When we have children, either they lost a tooth because of some type of an accident or like some type of sports, or they probably did not have a tooth come through. So these are the most common reasons why we have this question. So yes, you have a valid concern. If you need to have a tooth replaced with a dental implant, 11-year-old is too young to be receiving a dental implant. So what we normally say is, we need to make sure that your growth has stopped, your growth spurts have stopped, right? One of the most common questions that we ask people here is, hey, are you still growing? Most patients no, right? Like when the girls are age around 15, boys around like age 16 or 17, we ask them, hey, are you constantly changing clothes sizes, or are you constantly changing shoe sizes? And you most moms and the kids, they know that whether they are still growing, and we tell them, if you do know that, then you have stopped, then we can proceed with the dental implant. And nowadays, with the most common options that are the great options that we have available, we call them as, what we call it as a trays, right? Take that the S6 tray out for me right here. Oh, there we go, right here. This is a tray that you can use. If you're going to wear it for, like, let's say you are 11-year-old, for 4 years, what's a big deal in wearing it for another 6 more months? So make sure that you are completely grown out, you're completely stopped growing, then you can have that. Or if you're concerned about having something like this, and you can have a flipper, like this. And a lot of times what happens is kids are going through braces. So when you are going through braces, talk to the orthodontist and they can put a fake tooth right in the middle for you. It can be a part of the braces, and then once you're completely done with the braces, then you can have a tooth replaced with a dental implant. So there are multiple options available. Make sure that you completely stop growing at age 15, 16, or 17. Then you can have the dental implant. All right.
All right. How often should I be screened for oral cancer, especially if I'm a smoker?
So, how often you should be screened for oral cancer, and particularly if I am a smoker? So, when you are a smoker, you are a high risk candidate for to have oral cancer. So, you should be strictly be seeing your dentist no matter whether you're a smoker, no matter where you think whether you have cancer or not. You should strictly be seeing a dentist every 6 months period. That's what our recommendation would be to prevent any type of oral cancer. So when you are a smoker, when you have a higher chance of getting oral cancer, then you need to be seeing a dentist, like I said. To answer your question strictly and bluntly, when you are a smoker, the chances of you having either cancer or a precancerous lesions or precancerous white lesions or red lesions or any type of cancerous lesion is very high, and these cancers can change. It takes like anywhere between 6 months these precancerous lesions to change from precancer to cancer. And we have seen it in several studies. It can range all the way from 6 years all the way to 35 to 40 years. So I guess, I wish I could answer your question, but 6 months to 39 years is kind of a huge range. So I really can't answer. So there are multiple factors. Hey, how much you smoke, whether you have a family history, whether you have other medical issues going on, and whether you have been wearing or whether you use any other tobacco products. So to answer your question, you have to go see a dentist every 6 months. That's my simple answer.
Okay. All right. Looks like we have another live question from Amelia. It says, "Hi, I'm Amelia, 35 years old. 5 years ago, during my pregnancy, I experienced significant gum issues when I neglected to treat. Now I've been diagnosed with stage 2 periodontitis, and some of my teeth have begun to loosen. If I choose laser gum therapy, can my gums return to normal? How many sessions of laser gum therapy should be necessary?"
Why don't you try that?
Try what?
Try answering a question.
Okay.
Well, you see that every day, don't you?
I see it every day, but you're the doctor.
Yeah.
I get it from you.
Well, try that, and then let me finish it up.
Okay. So the question is,
35-year-old,
35-year-old.
gum disease,
Mm-hmm.
and they need some kind of a gum therapy, right?
Yes.
And she's concerned, and then she had periodontal disease. She got it more than likely during pregnancy, or it got worse during her pregnancy.
Mm-hmm.
Now she needs to have a gum treatment to save her teeth.
Yeah.
So what do we do in our office?
We'll do the gum laser therapy.
There we go. Bingo, right? So more than likely, either we are going to recommend either a simple deep cleaning, or more than likely, if you have gone through what you're describing, you had some issues during your pregnancy, more than likely your teeth are starting to get loose. We may not just simply recommend a deep gum therapy, which is the scaling and root planing or a deep cleaning. And most of the time in our office, we are recommending a laser assisted deep gum therapy. That's what I think it sounds like you may need. But if it is advanced to the degree it is very advanced, then we may recommend doing a laser gum surgery. But from what you're describing, and you're young, and if you're coming to us soon enough, we may be able to do it just with the regular gum therapy or a laser assisted gum therapy without having to advance you to get the laser gum surgery done.
Can her gums return back to normal?
Absolutely. Yeah, thank you for reminding me.
Hmm.
Yes, the her gums will return back to normal as long as you follow our recommendation. And one more thing that we recommend, patients come here and then they listen to us and then they are thinking that okay, one and done. Absolutely not. Not one and done. And part of the reasons why you are coming here because you are not been going to the dentist on a regular basis. So after getting the one and done laser gum treatment or the deep gum therapy or the laser gum surgery, you need to come back every
3 to 6 months.
3 to 6 months. Correct. So more than likely it is going to be every 3 months because that's how often that you need to be being seen to get the gum disease under control. Okay, so every 3 months. If you are going to do 6 months, then you are more than likely alternating the cleanings between the dentist and us. Dentist, us. So every 3 months you are going to get the cleaning, but you are alternating between the dentist and us.
So 4 cleanings a year.
You got it. You got it. Finally, sound like you are listening to me.
Right. Okay. Another question we got is: is there a specific diet that promotes stronger teeth and healthier gums? This one for me.
So you are asking the question, or you already know that you are going to answer this?
No, I'm asking a question and
Oh,
I
okay.
second it.
All right. Okay. So the question is there any specific diet that is going to promote stronger teeth and healthier gum? You guys know this all the time, and this is one of the most common questions. And immediately, as I say that, hey, when I have gum disease or bone disease, and a lot of women are watching this, and you guys know this, and you guys take calcium to get stronger bone. That is the same exact calcium that you're going to be taking to health and to make your teeth healthy also. So calcium supplements that you're taking, that is going to help you with your bone as well as your teeth and your gums also. And vitamin D, it is one of the more common things that we see, like to strengthen your bone and gums. And so if you are vitamin D deficient, make sure that you are going to get your vitamin D deficiency treated. A lot of times when we see, like, even and they're kind of a borderline, when they are getting gum surgery done or any type of bone surgery or oral surgery done, we supplement them with with the vitamin D, and also protein and high fiber, and all these things are going to really help you not only to with your body, then also to help with your gums and teeth as well. And then make sure that no sugar, right? No
Right.
sugar, because that's bad for your teeth. Because whatever, let's say you take a bunch of calcium to strengthen and you drink Diet Coke, you pretty much kind of washed out, right? So no sugar, no Diet Coke, even no Coke. And in Texas we say no Dr. Pepper,
No, we
right?
say no sweet tea.
No sweet tea. There we go. All right, no sugary foods, okay, and no soda, right? Okay.
Right.
Water is good.
Water.
Water, water, water is good.
Okay. All right. So next question we got says, I'm a 60-year-old. I'm 60 years old. My teeth are breaking and falling out. I only speak Spanish, so I need to know if you offer services in Spanish. Additionally, I would like to inquire about the insurance plans you accept and your pricing.
Try that answering. How do we help Spanish speaking patients in our office?
We have Spanish speaking staff in our office.
There we go, right? So we have a whole crew of people who speak Spanish. Right from the time when you call ToothHQ, we got people who can talk to you in Spanish. At the time that you come in, and we have a treatment coordinator or treatment counselors, they speak Spanish also to make you comfortable. Sometimes, they bring family who can speak English, but even sometimes it's just not enough. It's not like we can make a great connection with you when our treatment coordinator speak Spanish, because just like Trisha, imagine Trisha talking to you in Spanish. Can you talk Spanish? Poquito?
Un poquito. Un
Poquito.
poquito.
Okay. So imagine her speaking Spanish to make it comfortable, make you comfortable, right? So we can definitely do that. And to answer your question, whether do we have any insurance plans that we accept and our pricing, right? So we do have insurance plans that, or if you have an insurance plan, we can work with your insurance plan. And to answer your question, whether we have any payment option or some type of pricing, depending on what type of treatment that you're going to need, we are going to discuss the pricing with you, of course, in Spanish, and give you all the treatment options available and all the payment plan options available, including, we have a lot of Spanish speaking patients, and we they want to do like a kind of what we call it as a layaway treatment plan,
Mm-hmm.
because they don't feel comfortable applying for some type of a bank or some type of a loan. So they say that, hey doc, if it is going to be $3,000 or $2,000, let me come pay you every 2 weeks. I'm going to come pay you $500 every 2 weeks, and then once I have that $3,000 in my escrow or in my account as an AAA money, I'm going to come get the treatment done. So there are multiple options available. So if you're in the Dallas Fort Worth area, come see us in Tooth HQ. We can, uh, what do you say? Espanol. La hablas, what do you say?
La habla español.
La habla español. So la habla español. We will talk to you in Spanish and we'll get you taken care of. Thank you very much. Yeah.
You speak better Spanish than me.
There we go.
All right.
No more poquito.
No more poquito.
Okay.
All right. We have I was going to say it in Spanish. We have one more question. It says, "Hello, doc. I have a dental implant for my front tooth that I have noticed, but I've noticed persistent bad breath since getting the implant. Can implants be responsible for bad breath?"
Um, Great question. So this is one of the most common things that is a myth, right? And I want to absolutely. I'm going to probably take a little bit more time to answer this question. So one of the most common myth, and this patients lose teeth from periodontal disease or cavities. So as soon as they get the dental implant, they think that life is good, one and done. No, unfortunately not. The great thing about the dental implants, and as I said earlier, they look, feel, and function like a natural teeth. Another greatest thing is implants are metal. They don't get cavities. Can you drink uh, Coke with it and soda with it and still not get cavities? Absolutely yes. Unfortunately, if you don't brush them, or when you don't floss them, and when you don't keep them healthy, you are going to get gum disease around them. So you will still get gum disease around the implant, you will still get bone loss around the implant, and when you get bone loss and gum loss around the tooth, that's what causes the bad breath, because the gum infection. So to prevent this from happening, you need to go see the dentist, irrespective of whether you got natural teeth or whether you have single implant or multiple implant. You need to go see the dentist every 3 to 6 months. If you already got into the problem of you got some damage that's already been done, now you're doing some kind of a damage control, then you need to have that implant treated. So in for gum disease treatment, we call it as a periodontal treatment because we are treating a periodontal disease. And for implants, we call it as a peri-implantitis treatment. So the peri-implantitis treatment can be done in terms of either a deep gum therapy or a laser gum therapy. And we do not recommend doing traditional gum surgery around the implant because we want to treat it as non-invasively or as minimally invasively as possible. So we recommend that you get the laser treatment done. So my recommendation is, if you're concerned about the persistent bad breath before the implant gets uh, advanced gum disease or implant gets really loose, and I recommend you get your bad breath checked out and to see whether you are a candidate for either the deep gum therapy or the laser gum treatment, or the bite adjustment treatment that we normally recommend, which could sometimes be contributing to these type of advanced the implant problems also. If you're in the Dallas-Fort Worth area, come see us at ToothHQ and we can help you.
Yes. And not only does not taking care of the implant cause bad breath, don't that make the implant fail?
Absolutely, yeah. Eventually the implant is going to fail.
You just lost thousands of dollars.
There we go. That's a good point. Yeah, absolutely. Yeah.
Okay, Dr. V, it looks like that's all the questions for this section. How do you feel?
Feel great,
Feel
man.
great? Okay, good job.
All right.
All right, so until
Until
next
next
time,
time.
you and DFW come to Tooth HQ.
There we go. We are here to take care of you. See you guys next time.
Bye.
Bye.